All right, and we are live and ready. Can everybody hear me well and fine? Everybody hear me well? Good, bad, ugly?
Yes.
Yes, okay. I got one yes. There's three of y'all. Alex, can you hear me? I know Richard can. I'm going to assume you said hell yeah, and I'm going to keep going. All right. So tonight we're going to break into a little bit of musculoskeletal anatomy and the endocrine system. I've transposed it down to the EMTB level. We're not going to be talking about the actin and myosin filaments sliding across each other, but I do want you to know gross anatomy. The purpose of that is why. If I stab you in the upper right quadrant, I want you to know there's a liver behind there. Or if I am speaking the medical terminology to certain people, communication is not key, comprehension is key. People have to know what you're talking about, or you'll otherwise create chaos on an otherwise very calm scene. So we need to be able to know what we're talking about. But before I get too deep into these things, I wanted to address some things that I saw throughout the week's work. About 95% of everybody did a fantastic job with week one. They got onto the test, they beat the hell out of it, and a lot of people did the discussion board and beat the hell out of it. Very good discussion, went back and forth, just telling you, everybody, your why you want to be an EMT, which it's very important to remember that why when we're weeks and weeks into this thing and, you know, there's tons of work and you're just getting overwhelmed. Remember why you're doing it. You know, some of you listed family, some of you listed many good reasons to why you want to be an EMT, and that's extremely important to hold on to that. So my goal and job, I feel like, is to teach you how to do things, when to do things, but also tell you the why behind these things. That way we can increase retention. Also, it helps you foster critical thinking skills, because there are times that we will have a gray area where a protocol does not meet the situation on scene. And we have to do what is best for the patient on scene, meaning that we follow the first rule of medicine, which is what? Alex, how about you? Give me an answer. If you're listening, if you're there. To do no harm. The answer is to do no harm. Some of y'all, a lot of y'all put compassion. That is important. That is a very important piece of being a good EMT or paramedic, being compassionate. And I tell people, and you heard me say it the other night, that nobody cares how good of an EMT or paramedic you are. You should learn compassion first before you learn medicine. So that is true. But the first rule of medicine is going to be, okay, can't get your mic to work. I see you, no worries. First rule of medicine is going to be to do no harm. So if you're ever faced with a choice to harm a patient versus not, let's try and pick not, unless it is life-saving intervention. We have things that pop up from time to time that will be situational based. However, if the car is on fire and you need to get that person out before it therefore blows up, that'd be a life over limb situation. I also noticed some of you have possibly developed over the years of taking scholastic testing that may develop some test anxiety and don't think you're a very good test taker. That's okay. But this is a pressure job, so we have to allow you to sit in pressure tests. When we get to the National Registry, it is a written cognitive exam that will test your cognitive ability to think through these things, using your ability to see signs and symptoms, take a history, and, you know, formulate a treatment plan based off of a field diagnosis. When we hit the psychomotor, we're going to be testing your skills of actually performing scenario-based scenes and calls, and how can you physically perform these skill sets. So that's kind of where we're at. But before I get too far into this, I actually threw in a couple slides on testing strategy tonight to actually help you guys with possibly navigating through this next week's quiz. So we'll go ahead and get started on you. So I want to remind you, though, that embarrassment is the cost of entry. If you're not willing to look like a foolish beginner, you'll never become a graceful master. Myself, Mr. Larry, people have been doing this a while, been paramedics in the game a while. We have done some stupid things And I mean, I still plan, you know, time to time do stupid things, but we didn't come to this point in our careers by always, you know, doing the right thing all the time. People are going to make mistakes. That's why it's called practice in medicine. Your job is to try and mitigate someone's bad day and make them have a better day. But it's okay to look stupid in the beginning. You are fresh in EMT school. You're going to make mistakes, and it's okay to make these mistakes. I want you to make the mistakes here in the classroom and not in front of a patient or on a patient or to a patient or whatever's applicable to that situation. So it's okay to make mistakes here in the classroom, on a test, in a lab. We want to train you to the point where you're not going to make mistakes with a patient. I hope that makes sense to you, okay? So testing strategy, let me just move this out the way so I can see better. There we go. So everybody has what I call spatial time. I'm not sure what the actual thing it's called. I might be wrong in saying it's that anyway, but basically the way I feel about it is everybody has their phone on them 24/7. That's how most of us get information nowadays, either through Google, Facebook, Instagram, TikTok. You know, we're all guilty of that. But for the next, let's say 15 weeks of our time together, that time that you would normally be spending on your Facebook, scrolling, sliding in somebody's DMs, or whatever you're doing, that time should now be used for a way to prep you for EMT school, to either be doing scenario-based questions, to be, you know, reviewing anatomy, physiology, or some book stuff. Now, I really hope you take this advice and use it for the next 15 weeks of our 16-week course. It's a small amount of time to take a sabbatical from your social media. Some of you will do it, some of you won't. You know, it's on you, player. You know, I'm just trying to give you the advice that I've seen work in the past. So some other questions and rules that we want to follow when we are preparing for these tests that we're getting ready for is to read every question twice. The majority of my students that I find that are having trouble with, you know, a standardized test or computer-based testing, their issue is turning into trying to go too fast. Less than 1% of people actually fail the national registry because they time out. That won't have to be you. You guys will be bombarded the next 15 weeks with bigger and bigger tests. That way you are used to these tests. You have a kind of a test stamina built up, and it won't affect you the same way. So we're going to go over this testing strategy and get you ready for that. But my rule, and I want you to adopt it, I hope you will, is to read every question twice. Now, it is a timed test, so if you can answer the question immediately, you can go do that and buy your time back. If you spent a good 3 minutes reading this long page of a question they sent you about this scenario about Granny Smith down there on the farm doing something, then that will eat up some time, and it may make you think a minute about what the right answer is. So there will be questions that will be straight recall questions, which are like, how many bones are in the body? 206, bang, bought my time back right then and there. There are going to be recall questions on there. They're not all scenario based. The recall questions, if you know the material, bang, time is bought back right then and there. The next thing I want to teach you to do is to eliminate 2 of the wrong answers. Now, there is a bit of mythology about this for the registry. It seems that they put 4 very close answers as part of their answers, right? So you got a question and there's 4 answers that are very similar. Now, there are usually 2 of them that are way left field. So if you can eliminate the 2 way left field ones pretty quickly, you've at least given yourself, if you know nothing about the subject, a 50% guessing chance to pass the registry. So my next bit of advice is to, after reading everything twice, is to eliminate the 2 wrong answers that you know are not there, right? Then you can decide between the remaining 2, which one is the more patient-centered and correct, which one is going to be the more effective way to go forward, the more safety-oriented way. Many of these things are scenario-based, though, and they keep it pretty tight, but you got to ask yourself the big picture. Read it first, absorb it, and then look for those little key buzzwords like you should, or you should next, or always, never. What can you do? What is the best treatment? It's not always what you can do, it's what you should do. If I can fix this same problem with a less invasive technique and not hurt the patient, why would I not want to do that? So we're going to also look for some signs of criticality. This will affect the way you answer certain questions. It can be identified by things like altered mental status or cool, pale, moist skin. We're going to teach you how to identify buzzwords for the registry and for real patients. If you see a patient on the registry written paper that says shallow breathing, and therein, if you see a patient in the real world that has shallow breathing, you're going to know that that's a buzzword that's going to initiate, hopefully, a response in you to use that BVM we learned about in CPR class to bag them, to breathe for them, to provide mechanical ventilation for them. So when you see these signs of criticality, you're going to need to act on them and pretty quickly. I want you to watch out for airway questions. When we get to airway, you'll understand this a little bit more, but the airway questions are usually trying to see which gun are you going to pull out and shoot. Not everything needs a full-blown CPAP face mask, blowing air in and forcing all that positive pressure to the lung space. Some things can be fixed with a nasal cannula. I have fixed congestive heart failure patients that were having PVCs popping off because their ventricles were irritated with just sitting them up and putting them on a nasal cannula, give them a little oxygen, and they chilled on out without me having to get very invasive and hurt them or any kind of anything else. So they're going to be looking out for those airway questions. I want you to read the question, but not read into it. Who can say that they are guilty of overthinking sometimes? Alex, I know you're only in the chat, but if you want to go ahead and respond in the chat, I'll accept it. And Richard, you can pop in if you want, if you're not running a call. So I'm going to assume you're both like, hell yeah, I do that sometimes. I overthink things, right? Okay, well, me too. So sometimes we try and read into these national registry questions and we overthink them. The good thing about the written registry test and written exam questions is that there's no extra. Whatever's written is what it is. There's no extra things there. If it says he's bleeding out from that spot right there, then that's exactly, I definitely do. I see you, buddy. All right, well, I do it too. It's part of it. So the cool thing about this is the written exam is you don't have to overthink it. What is there is what's going to be the answer. All the answer is in the question with these scenario-based questions. So don't overthink it. Just read what's in the question. Now, the problem I have with psychomotor registry is that there's a lot of things that the scene can tell you. You know, certain smells, certain feels of the environment, certain instinctual things that'll kick in once you've done this a while. You know, things that you'll automatically do and that you now have to vocalize. It's hard for the conceptualization of a new EMT student who's never had to do those kind of things in real life. You'll see what I mean once you start your third rides and you start actually being out there with real patients in an emergency situation. There are some smells you just don't forget. There are some situations that will trigger things in you, I promise. So don't read into things. All right, so here's something that might be a new concept for you. I want you to pay attention to this. Read the last line of the question first. Then read all four answers. Then go back and read the entire paragraph / question. This helps to determine exactly what the question is asking you and gives you real potential answers. You'll already have in your head a potential answer for what's going on. National Registry is a multiple choice. Now, I know from your last quiz I gave you, you actually had to fill in the blank on one. And hey, it's probably going to happen again. I'm not National Registry. It's me, your boy Josh. So it's none of that. There's going to be some multiple choice, but I want you to fill in the blank too. I want to see if you can recall some of this information. If you can recall it, you can use it, and it's retained. The cool thing that I like to do is I do what's called spaced repetition, which means once I give you a concept, I assume and I believe that you are responsible for that material. So we might be on week 16 at the end and you're at your final exam. I can promise you, you're going to still be seeing week 1, week 2, week 3 material. We could be on week 5. Guess where you're going to still be seeing? Week 1 through 5 material will still be in our test bank of stuff you're going to need to know. I hold you responsible for it. But there is a caveat to that. There is good news to that, because I believe that if I can continue to hit you with that repetition, that you will retain the information. My full-time job is teaching the paramedics at the Atlanta Fire Department and at Fortis College. And I've learned that firemen learn one of three ways: pain, embarrassment, and repetition. I'm gonna give a shout out to my boy Chris Bailey at Fortis, former Army Ranger. That was his saying. I stole it. I'm giving him credit this one time. He said if I use it, I had to give him credit at least once. So that's what I'm doing. I'll give him credit. But it's true. The goal is to give you this theoretical information here. And once we start labs, tie these two things together, marry these two things together so that you can conceptualize it and then use it on real life patients. So read the last line of the question first, and then you can see about answering it then thereafter. And take your time and always be that patient advocate. All right, so I want you to keep it simple. This is an old fire department saying that I learned when I was a recruit many moons ago. Keep it simple. The test is not trying to trick you. I heard a representative from National Registry at the Educators Conference a couple of years ago actually come up here and say that he's like, this is a myth. The National Registry test is not trying to trick you. It is just trying to see, can you perform minimal standard competency to be an EMT or a paramedic. So we just don't want you to kill people. We want you to do what's right by them. We want to see if you have the cognitive knowledge to perform in this task. I'm like, okay, I'm all for that. Night one, I told you I have to train you like you'll work on my 2 children. Therefore, I have high standards, and I want to make sure you won't kill anybody else's children, because while they're in the back of that ambulance with me and you, their kids are our kids. Their grandma's my grandma. That is the ethics of EMS. We treat people like family. So there we are. Any questions so far? Cool. So I want you to remember that the test is not 80 to 150 question test. I think the EMTB is actually 70 to 120 questions, to be honest. So don't look at it like a 70 to 120 question test. It is a 1 question test that you take 70 to 120 times. What I want you to do is, while you're on that 1 question, put everything you got into it, all your focus on that question. Treat that question like it's the one that'll make you an EMT, because it very well could be a deciding factor in that. So I want you to put all that energy you have into that 1 question. Once it's gone, don't think about it again. Put yourself in the mindset of this new question, because sometimes we give you questions that'll be like, well, if Jimmy Joe's doing this, he's got this going on. The next question has still to do with Jimmy Joe and the guy behind him. Registry doesn't do that. Once you get a new question, it's a whole new patient, whole new scene, scenario going on there. So before you test or do any kind of testing for me or for the National Registry, I want you to get your head in the right place. I said this earlier, this is a pressure test. This is a pressure job. There's a lot of pressure having somebody beg you not to let them die. And once it happens, it changes you forever. So change your mindset. It's okay to let this pressure be there. It's going to be good. Pressure makes diamonds. Pressure, that compression is what makes the diamond. So hopefully that does not scare you away. I want you to work hard for this, and don't be scared of it. You guys are going to work really hard for me and Mr. Larry for the next 16 weeks. And you will have earned the right to sit for the National Registry. So don't just clear your mind. You've put hours into this. You're going to hear countless lectures from me and Mr. Larry. You're going to do tons of labs. We're going to make sure that we would trust you with our own families before we release you to work on anybody else's family. I could care less about the shortage. I mean, of course, I care about the shortage of EMTs and paramedics, but it's not going to affect me. I'm not going to microwave you when you must be crock potted. We're not going to cut corners with you. You will be good before we release you, because that's what our communities need. And EMS is about community. So don't go in there wanting an easy test. Want something to challenge you. Life's about a challenge. All right, so the night before, don't cram, stop studying, relax. I want you to smoke a doobie or whatever. I'm not saying that officially, but just relax. Cram time's over. Spend time with your family, your dogs, and then sit there, and I want you to remember why you started this. Week 1, I had you write your why down. The end of our time here, I'm gonna have you read it back to yourself and see if it still matches. Your why. Why did you start this thing? You're gonna need that why when things get hard, when the material becomes harder, when we're testing the crap out of you, and when you have that anxiety building up for the day of your actual real national registry test. It'll be back. You have to remember your why. You know, we're doing it for our communities, for our families, to make our families proud of us, but also to have a job. We'll always have a job in EMS. People are always going to be sick, but also to have, you know, to be part of that honor system of first responders. I've never regretted it. I have loved it. And my God, that high of saving somebody's life, there's nothing on earth that will touch it. And you will spend the rest of your career looking for it. You will, mark my words, the first time you save a life, the first time I did, I was riding home that morning because I worked night shift in Macon County. I had my head out the window like a dog, man. I was just grinning ear to ear. Like, it was amazing. I was like, that's why we do this. Yeah. I was really hyped up, but it's an amazing feeling, and it's the one I want you to have. So the day of, I need you to wake up early and get a workout in. And even if you're not a working out person, do a brisk 30-minute walk. There are university studies that show that students that do a little bit of exercise before they take a big high stakes exam, they test better. They test better. I think it was University of Florida that actually put EEGs on students. And when they took these tests, they saw that their brain was lit up. The ones that had done the exercise or even a 30-minute walk, their brains were lit up like Christmas trees. Another thing is to get you a healthy breakfast, one that's going to fuel your brain, not your cravings. Don't be going by Waffle House and getting the All-Star. Now, that ain't the way to do this. Get you something that's going to sustain you so you ain't in there hungry while you're doing these kind of tests. And this goes for your national registry. This goes for your tests that you take for me. Make sure you're ready and set up and not going to be interrupted while you're doing these things. So another thing to remember is that there are two ways to get the question right. One's to know the answer. The other was to know that the other three choices are not the right answer. That breaks it down really easy. I'm not sure exactly, but I know these three cannot be it. Bang, it's A. So that's where we're at so far. Any questions so far? Comments, concerns before I start digging into this musculoskeletal anatomy? What do you think? Anybody? Nothing? We shall proceed. All right, so the musculoskeletal system, again, this could get highly complicated when we talk about the paramedic patho level or the nursing patho level, where we're talking about actin and myosin, sliding filaments of the muscles and how they worked using the neurotransmitters. However, at the EMTB portion right here, we're just concerned with you knowing the gross anatomy, the big physical units, and kind of what the musculoskeletal system does. So it provides form. It provides form, gives your body a sense of form, of mass, of bulk. Helps provide upright posture. It provides movement to the human body. Your muscles are what move things. It uses the bones to kind of push off of, and the muscles actually move things. All right. So what about the muscles and bones together? What do? They protect vital organs. Think about your chest. All right. That rib cage is meant to protect your lungs and your heart, and the pecs and the other muscles around there are meant to also help provide additional cushioning and protection. So that is what the big purpose of this bad boy is to provide protection, provide form, upright posture, and movement. I got a chat bubble. What you got? Let's see. I appreciate the study tips. That's very helpful. It is just trial and error that we have seen work through the years. And me personally, every 2 years as an EMT or paramedic, you have to recertify your national registry by either taking a bunch of classes or you can challenge the test. I still take a bunch of classes because I want to be, up in the know about what is the most common evidence-based medicine practices for my field. However, as a paramedic instructor and EMT instructor, I like to take a look at that thing. So the last couple of years, I've actually retaken my national registry, and these tips have worked for me several times now. And I also compared them to a bunch of national registry prep sites. These are prep sites that'll, you'll pay money and they'll help get you ready for registry. And their tips are the same as mine. And once I found out that all of our stuff lined up, I'm like, send it. Let's do this. So it seems to be a working strategy, and I'm proud and happy to share it with you. All right, so the musculoskeletal system, muscles, is composed of fibers that contract. It'll cause movement. There are 3 types of muscle tissue: skeletal muscle, smooth muscle, and cardiac muscle. So cardiac muscle is obviously the type of muscle that is around your heart. Cardiac muscle is the heart muscle stuff, right? Cardiac, heart, get it? All right, smooth muscle will be your guts, your lungs, your reproductive organs. Those are the type of smooth muscles that we're talking about. Skeletal muscle, some of these right here. Oh yeah. Skeletal muscle is ones that are actually attached to bone that are purposeful for movement. Everybody make sense so far? I'm gonna assume you said, hell yeah, Joe. All right. So the striated skeletal or cardiac muscle. Skeletal muscle does what? In a nutshell, this is what I'm gonna test you over. Controls voluntary movements of the muscles. Hey, what does the skeletal muscle do? Test question. Hey, test question. Giving you breadcrumbs here. Skeletal muscle tissue controls voluntary movements of muscle. All right. Cardiac muscle. It's responsible for what? It's also called the myocardium, composed of intercalated discs to allow communication of over 400 times faster than regular muscle tissue. So the heart's a very interesting muscle. If we remember it from the last lecture, we talked about the automaticity of the heart, which means it creates its own electricity. And that electricity is what causes the contraction in the heart to move. The muscles of your muscles here, you know, the skeletal muscles, electricity moves them too. They must contract to move, right? And your non-striated muscle is the smooth muscle. Let's do that again. Everybody say smooth muscle. Oh yeah. So smooth muscle, these are found again that are controlled by the digestive system, bladder, and it has a lot to do with your constriction or dilation of your blood vessels. So we got skeletal, cardiac, smooth muscles. So we got those big three. That's all. You'll have one of those three types of muscle tissues going on. All right, so skeletal muscle attached to the bones of the skeleton. Wow, is that why it's called skeletal muscle? Yes, yes it is. It attaches to the skeleton. So can you name one right now? All right, Mount Biceps. Oh yeah. All right, so the bicep, that's the skeletal muscle. Good, easy one. All right, they form the major muscle mass of the body. So the heart, as you can probably, we talked about, it's about the size of a closed fist over here. That's only a small percentage of the muscle tissue you have. When we talked about the smooth muscle, we talked about the lungs and the vessels and the reproductive system. That is, again, small amount of muscle tissue that you have. The majority of your muscle tissue is going to be the skeletal muscle tissue. This is also called voluntary muscle. Can you guess why? Can you guess why? I am voluntarily moving my hand away. I chose to do that badly, but I chose to do it. So it's voluntary because I have some control over it. There are people that can probably control their heartbeat and stuff like that. I ain't one of them. But for the most part, my heart does what it's going to do. It hopefully keeps beating. Same thing with a lot of your smooth muscle. It's not involuntary control of what you do. Now you can control your bladder's sphincter and your pee flow and stuff like that. But we're talking about different muscles down there that are not normally always under voluntary control. So how do they move? Contraction or relaxation is what causes movement. So with contraction and relaxation, it's what causes the movement of those muscle tissues. All right, so now we need to talk about the covering. Every muscle we have is covered by a thin layer of connective tissue. This is called the fascia. The fascia surrounds every muscle, and it may form the cord-like tendons beyond the muscle's end. I like to think of it as like a little protective layer or force field or something. It attaches, stabilizes, and closes and separates muscles from other internal organs. Now, the thing about the fascia that I always like to point out to students is that imagine a patient that's been burned. A patient that's been burned will have, sometimes that fascia will turn into a leathery-like substance called eschar. All right, so if a patient's burned, that stuff we're looking at right there that surrounds the muscles, it'll turn into like a leathery type of thing, and it can actually constrict and cause perfusion issues, which means blood flow will not be flowing to that tissue. Now, even worse would be one that gets, the chest is burned. So it'll be like leather, and they can't expand their chest and breathe very well. So what they have to do is what's called an escharotomy. I saw this one time in Grady's ER. It was like really cool. But the guy had burns on his chest, and they just took a scalpel and slit him open and like performed an escharotomy. He started breathing really well after that. So it was neat to see. So that is our muscular fascia. Again, I'm going to ask you some type of question about this slide and what fascia is, does, or maybe something about the Escharotomy. I don't know yet. How evil I feel that day. All right, so looking at the gross anatomy here of just the main muscles I want you to know. Like there are a ton of like super like small ones, but for us in EMS, again, you don't want to talk in terms, especially the EMT level, talk in terms that people can understand you. Again, if I'm saying these $10 medical words on scene and the hose dragger crew of firemen's over there like, what you talking about, Willis? So you got to talk so people understand you. Hey, his latimus dorsi's got a big laceration on it. Huh? His back muscle got a cut. Will you please hold pressure here so he don't bleed out? Oh, okay, I got that. So I'm not telling you to talk, crazy layperson all the time, but you got to meet people where they're at. We years ago swapped to what's called plain talk. Everybody used to have their own 10 codes and their own way of saying things and doing things. And there are still some departmental sayings and codes. Like I know at Grady, we had the code 11, which was the Mayday, send all help now. Somebody's about to whoop me down or beat me up. So, there's still codes that go on, but for the most part, especially for interdepartmental mutual aid situations, we speak plain talk. Hey, the red truck, it had 2 patients in it. Will you please grab that? We just talk so everybody can understand us. Even on the radio, no more 10 codes. We talk so everybody can understand us because we don't want to create more chaos and make more trouble than it's worth. So I want you to study the diagram here. And these are the main muscles I want us to memorize here. So the trapezius, the traps, we're talking about these bad boys up here, right? Let me get my little pointer out so I can actually annotate. Oh, yeah. All right, so when we're talking about traps, we're talking about what? Let's take a look at these bad boys right here. Everybody see my little blue marker thing? Traps. On the back of the male here, we got the traps, and on the front of the female here. If you took CPR with me here during your orientation, you probably heard me talk about ways to elicit a pain response to check a patient's mental status, right? So with that, we had sternal rubs and trap squeeze and nail bed compression there, but the trap squeeze is located right there. All right, so deltoids, we're talking about that shoulder muscle. Deltoid is some of that shoulder muscle. All right, the biceps, where they at though? Right here. That's your bicep. Everybody can see that? Cool, cool. So with the biceps, we got the biceps there. We need to know that's going on there. Now quadriceps are down here. We call that pretty much the thigh. That's the thigh muscles right there. All right, and then you got your tibia, anterior tibial muscles here, and then you're at the back of the leg, you got the gastrocnemius or gastrocnemius, whatever. Calf muscle. Calf muscle. See there? That's why we talk plain talk and barely pronounce these things. All right, so where are we at? The rectus abdominis. Now, some of these things have clues, right? Everybody knows that the abdominal muscles, what? So rectus abdominis, that would give you a clue where it's at. About pectus minor, pectoralis minor. So pecs, everybody should know where the pecs are at, right? We call this in Atlanta making the bird dance. Dance, bird. All right, so that's enough of that. All right, so the pecs right there, that is going to be the front part of your chest. Lats, we talk about these back muscles back here. Triceps are the back of your arm. The gluteus medius, if you saw the professor, gluteus maximus will be the inner part right there, and then the maximus will be that bigger part down here at the bottom. So now we've got a complete understanding of just the gross anatomy. I'm gonna get a little bit deeper, but we're not gonna go too deeper here at the EMTB level. I just want you to have a good understanding, be able to identify these muscles for landmarking and for communication with hospital staff and other first responders. Sound good? Yes, Josh, sounds great. Oh, you guys are awesome. All right, moving to the next slide. All right, I should probably erase that because it's going to affect this slide. There we go. So how do muscles get energy? We spoke a little bit about this in one of our first slideshows here, is that muscles get energy via the cellular respiration cycle. Now that again can get very complicated, but basically we need to know that anaerobic metabolism is when water, sugar, oxygen go into a cell. In that cell, they perform what's called glycolysis. So glyco, sugar, lysis meaning to break. So breaking down the sugar to create energy, right? So with that energy creation, we have adenosine triphosphate be created. That is energy, right? So that energy is used by our body to do stuff like wave your hand or blink really fast. So there is a byproduct though, and Mr. Larry will cover that when he hits the respiratory system with you guys later this week. But that byproduct of the cellular respiration at the cellular level is CO2, mixes with water, forms carbonic acid. We breathe that out. So it's called gas exchange, and he'll cover that in respiratory anatomy. I don't want to get too far into it and throw you off the muscle track, but we breathe in oxygen. Everybody can agree on that, right? We breathe out CO2. So, yummy, good oxygen. There went some CO2. All right, so the product of cellular respiration is adenosine triphosphate, and the metabolism byproduct is going to be CO2, which is, again, mixes with water, forms carbonic acid, transported via our bloodstream to the lungs. You breathe it on out. There it is. And again, I love the component about recording this. That way, if you be like, what did he just say? Let me do it again and again and again. I have a weakness for math. I hate it. And I'm taking like a college math class. And if it was not for me being able to rewind that woman, I would be up the creek. I am telling you. And you may feel the same way. Hey, if it wasn't for me being able to rewind this fellow with his Southern drawl and his, animated mannerisms, I would not be able to understand a word he's saying. So here we are. So what about oxygen use and debt? Oxygen use and debt. So we talked about the anaerobic metabolism, and that is when the cellular respiration is performed in the presence of oxygen. Now, when cellular respiration is performed without oxygen, it's called aerobic metabolism. Okay? Aerobic, A meaning without, it's a medical term meaning without. So we're talking about anaerobic. Struggle with math too? Yeah, math sucks. I did figure out that I asked a friend of mine, because I teach at the college over here too, and he was telling me like, you know what math really is? I was like, no, because it sucks. And he's like, it's teaching people how to problem solve. I was like, probably could have skipped trigonometry in school and probably went straight to like, balance in the checkbook or how to buy a house or something useful. What do I know? Just an old paramedic. So anaerobic metabolism respiration is required for energy when skeletal muscles are used for more than a minute or two. Anybody ever worked out and then felt that burn in your arms and had that soreness there? That was the creation of lactic acid, right? That creation of lactic acid. Oh, Beardy Locks is here in person. Hi. You're late. I don't care. Dispatch stinks. You tell them I said so. No, I'm scared of them. Might give me a long call or something. All right, so let's see. You learn better in the classroom. This was very challenging to me. Hey, I get it. We must adapt and overcome, or you will be overcame, right? I think we all like the component of being in person and sharing as humans, but again, with the flipped classroom format, you guys have the, I'm responding to a chat thing, by the way, if you're watching this in a recording. So that's the cool thing about attending the live stream is you can chat with me in person. And, John here actually came in person. So, yeah, I get it. I prefer to be in person because I like to pick on you and talk with you and, be a little bit more personable. But with this format, you can rewatch and watch again, and you can do this in your own time. With all you guys' crazy schedules and stuff, there's no way that we could meet like we would do for a traditional EMT or paramedic class. So I get it. I'm sorry. Love you anyway. We'll hang out for labs. We're going to meet for labs in person. So we'll see how it goes. What about oxygen debt? Develops when a person is exercising strenuously. So we develop what's called oxygen debt. Oxygen is mostly used to synthesize ATP, which is what? Adenosine triphosphate. And as we put ourselves in oxygen debt by working out, that develops as lactic acid increases, right? So when you work out, and what your muscles do generate is a large amount of heat. Most of the energy released in cellular respiration becomes heat. Muscle tissue generates a large amount of heat. Muscles form much of the total body mass. What type of muscles form the most of your scholarly mass? Oh, God. What type of muscle forms the majority of your body mass? What do you got? Oh, yeah. So we got skeletal, cardiac, and smooth muscle. Not smooth, smooth muscle. Well, that's your reproductive system in your guts and your lungs. Skeletal. Oh, yeah. Throw the bicep up. There it is. That's terrible. Go work out. Throw some protein on you. All right, so the actions of these skeletal muscles cause unique movements based on the type of joint to which they are attached to and where they attach. Let's take an example of the deltoid, located on a ball and socket joint. Literally, the head of my humerus is what? It's a little ball, fits in a socket. Hopefully it stays there, right? But because of its unique attachment, I can do some different things with it, right? I don't have great range of motion because I'm getting old, but because of that ball and socket joint thing there, I got a different type of range of motion there. All right, let's say your leg. Can I bend the front of my leg this way very well? No, that would hurt. The way it's attached is, though, I can flex it in, but it's going backwards, right? So I can flex it like this, right? Y'all can't see, but he can. All right, I'm gonna stand up. I'm gonna make fun of me. All right, so if I flex the leg like this, I flex it in like that, it's all good. But if I try and go that way, I'm gonna hurt something like my knee. That wouldn't be very pleasant. I would crawl on the floor and cry. So unique movements based on where they're attached. Can a tricep do what a bicep does? No, one's a pusher, one's a puller. Quick question. If you're willing to make the trip, I will put you on a Forsyth 911 unit, let you get it. Also, if you want to come for every lab every week, you are more than welcome to, but the majority of your Savannah cohorts, they just couldn't swing it every week. Hey, and I get it, because I'm driving 4 hours to see y'all either. So we gave them every 3-week option. They seem to have taken it, and I sent a schedule out. But if you want Forsyth 911, you are welcome to it. If you want to show up every week, you are welcome to it. I will not turn you away. So, where's that at? No, there it is. So when these things appear at rest, its fibers still undergo some sustained contraction known as muscle tone or tonus. Yes, you are welcome. So even sitting here relaxed like I am, there's still a lot of tone to these muscles. Oh yeah. I used to be in shape, believe it or not. So there's still some tone to them even at rest. How am I blowing my phone up? I ain't gonna answer this. Me and you are in a thing right now. All right, so origins and insertions. The relatively immovable part of a movable joint where one end of the skeletal muscle is fastened. John, break that down for me. What do it mean though? Louder for the people in the back.
I guess it's just like, so the point, it's like the joint in a machine, right? So
actually, yeah.
Pulls off of something to move another object, like a fulcrum and a lever.
Like a fulcrum and a lever?
Yeah. So like if your elbow is...
God bless it, Gump. Who told you to be so brilliant? That's
like
right.
If your elbow is the fulcrum, then your forearm muscle, that would be the origin. Your forearm muscle would contract to pull the rest of the arm.
There's hope for you yet. Dang. All right, so that's right. So where it's fastened at is where it can be using itself as a lever to move things, right? All right, insertion, that's the area where the other end of the muscle connects to the other side of the joint. Everybody got that one? John, tell me about that one. You've earned your name tonight. I'll call you Beardy Locks later, but tonight you can be John, your real name.
Yeah, I guess the insertion would just be the other end of that. So, muscles pull, right? So if you have a point that they're pulling off of, then they have to be pulling something else.
Exactly. If they didn't have an insertion point, they'd flap around in the wind. So they have to have a point of origin and a point of insertion. That way they can stay connected and perform their actions of whatever their actions are, they're designed for, right? Not bad. So when the contraction occurs, the insertion is pulled toward the origin. Let's take a look at the bicep right here. We need to work out. Tiny bicep. Good. So the origin is up here at the top of the humeral head, right? And the muscle body's down here. Let me get my little pin out. That might help. Oh, yeah. All right. So if you can see this or can't, here's the origin up here. Here's the little bicep body. So as he contracts and lifts his arm up, this thing right here will slide up and help him perform the action. There could be more than one area or origin of insertion, but for this example right here, we're looking at one origin, one insertion right here. Does that make sense to everybody? Basically, it needs to have a point it's attached to so it can perform its function. It works off of a lever function. Is that simple enough? All right, I'll take it. We want to erase all this for this on the next slide show. There it is. On with it. All right, so muscles are named according to their location, their size, shape, origin of their fascicles, origin and insertion, number of heads, and function. So I'll give you an example. Tricep. Anybody that's ever set foot in any of these gyms around here? I go to Gold's Gym. So you're an LA Fitness guy? You disgust me. Get out. Did you go? Gold's Gym does have a pool. Where do you live? Well, the Gold's Gym in McDonough, Georgia's got a pool. Represent. Anyway, so the tricep, let's break it down. Tri means 3, right? The tricep has 3 heads. That's why it's named tricep. All right, let's try another one. Bicep. How many heads do you think it got? Oh, okay. He figured it out. Bi meaning 2. Okay. So sometimes these guys are named based on their origin, their size or shape, number of heads, their function, those type of things. So that is how these things are named. Now, again, I don't want you to get super complicated in the EMT realm. Keep it simple, stupid. Kiss it. That's old. You was in the fire department, wasn't you? You remember that saying? We used to preach that. Now, kiss it. Because if you get too highfalutin on us, we can't understand you. That's going to be a problem. We don't want to create chaos. We want to make the scene we're on as smooth as possible. As smooth as possible. That's what I'll be wanting. So I provided another diagram here to just give you another deeper look at some of these things. So let's take a look at the biceps brachii, triceps brachii. All right. What else do we got? Sartorius. Ooh, that's a good one. So where's the sartorius at? Can you see on your thing there, John?
Looks like your lower chest.
All right, let's take a look. Here's sartorius. It comes in, this is little one right here that crosses right there. That's your sartorius. Got ones like your vastus medialis, vastus lateralis. And again, on scene, I want you to be like, hey, his thigh's got a cut on it. Hold pressure there. Can you imagine how much, disdain you would turn up if you're just trying to use all these big $20 words? I was that new medic. Yeah. I was the new medic that was talking like that, using all the big words.
Laceration on his sartorius major.
Yeah, his major sartorius. Yeah, his legs cut. So, I was very blessed to work with some very experienced firemen that kind of knew where I came from. And I wasn't trying to be a smart butt, but I was just trying to I thought everybody talked like that. So, and again, you can talk to the doctor like that, but first responders, lay people you need to do things to run your scene. Kiss it. Keep it simple. Then again, even giving a report to the ER, some of the nurses, they're talking plain talk too. We're just trying to, get to the root of the cause and the problem here, So I do want you to remember sartorius because I do have a worksheet for you at some point. The rest of them are pretty easy, but I knew that one would be one to throw you guys off. So again, the main thing I'm concerned with is to identify the big muscles. So starting from head to toe, what do we got up here? Neck muscles, sternocleidomastoid. So we can say simply his neck muscles, right? All right, we got the trapezius, got the pecs, deltoids. You know what? Come here. You'd be a good example. We have beardy locks here. Hi, everybody. All right, so what them pecs at? Point to them. Oh. So if you're watching this later on, you know, feel free to do this. Just, you know, don't judge, don't let your family judge you for this. This is important. All right, so we found the pecs. That's your chest muscles, right? Where's the deltoid? All right, shoulder muscles. All right. We're not trying to get too complicated with it, but I need to know where the shoulder muscles are, right? All right, let's see. Abdominals or lack thereof. All right, that's all right. That's where they're at. No. I have plenty of abdominals. Six packs are for losers. Kegs are for legends. All right, so forearm muscles. What are those called? Good question. We'll call them forearm muscles. All right, thighs, quads, hamstrings. All right, and of course the calves, the soleus and the gastrocnemicus, but we can call them calf muscles. You're blessed if you have big calves. I've been working on mine for years. They will not grow. That is my problem, not yours. Very good, thank you. So we're not trying to get you super complicated, but we do need you to be able to identify muscles in a very simplistic type of way. We're going to use John there as an example. We're going to put them all over the interwebs too. I don't want to see this on anybody's OnlyFans either. This will not be, it's copyrighted probably. Is it? No. All right, so what about the muscles of the thorax? Again, we got the pectoralis minor, internal intercostals, serratus anterior, which is where that'll be your muscles over here on the side, your diaphragm's located in there, and your scalene muscles. So the big ones I want you to take away from here are pectoris minor, intercostals. That's important when we talk about respiratory emergencies because some people actually develop difficulty breathing so bad, you can see those intercostals really sucking in and out, trying to push air in and out. They're having a huge time breathing. From the picture, it does look like they're under that. No, they're above the rib cage, but they're the muscles like the rib meat. Okay. If we was to have like, if you was a cannibal, we, it's that rib meat, the muscle attached to the rib there. I'm not a cannibal. All right, so the next one we'll talk about is what? The internal intercostals. And I've actually seen those and the clavicle muscles like really working on a patient that's having trouble breathing. Also, these sternocleidomastoids right here, these neck muscles. A patient really having trouble breathing, they'll be using all of that, struggling to breathe. So that, their positioning, their presentation, these are all clues about how bad they're actually having a time to breathe. Also, we want to know about these things. Why? Because what if there's an injury there? I need to know what's there and what's underneath there. So right there behind that sternum, there is a big organ we talked about last week. What can you think it is? Love dub, love dub, love a dub. It's my new mixtape. Also the sound the heart makes. All right, so the heart's right behind that thing. But the function, one of the functions of the musculoskeletal system is what? Protect vital organs. That's right, protect the vital organs like the heart. That's what I'm saying. Go to the gym, build the chest, protect it. Oh yeah. All right, so major muscle movements, upper extremities, we got the major flexors. Flexors do what? They come in. These are your pullers, right? Your deltoids and your biceps are your flexors. Remember, flexors pull in. We did this last week. Pull in, extend. So therefore, my extenders are also my deltoid because they can do both, and my triceps are my extenders. Remember, one pushes, one pulls. If it's too complicated, we're talking about flexing and extending. One pushes, one pulls. That's about as simple as I can make it. John, you got it? Hell yeah. All right, back to abduction, adduction, medial and lateral rotation. Ooh. All right, so abduction. Remember, abduction, you push people away from you that want to do ab work, okay? Abs are for the devil. It's like cheating on your wife. It's really bad practice to get into. So abduction is pushing away from the midline. Adduction, ADD, add, is bringing towards yourself, so bringing towards the midline. Remember, medial and lateral rotation, medial, midline, medial, middle, that's coming towards the center midline. Lateral is going on the lateral side, outside, farther away from the midline. All right, so these guys are capable of that too, to a degree. The triceps are capable of that. Deltoid is definitely capable of that. And there are some other accessory muscles in there that can be a part of that. So lower extremities. Oh yeah. We've got the muscles of the hips, which cause movement of the thigh at the hip joint, various lumbar and sacral spinal nerves that innervate this area. So we got a lot of muscles there in the quad. We got inguinal ligaments, the sartorius. That sounds like a gladiator of some sort. It's pretty cool, actually. I'll get my mother name me something cool. Oh well. The rectus femoris, vastus lateralis, quadriceps tendons, adductor, gracilis. So we got a lot going on there in just the thigh meat alone. Me personally, I'm gonna call it the drumstick. That's it. Keep it simple. This is EMTB material. I don't want you getting too crazy. Now, the more you know, the better provider you'll be and the better setup you'll be to learn the increased path of AMT and paramedic, med school, PA school. I know some of you express aspirations for that. Hey, I'm all for it. You know, there's always a spectrum of understanding. You know, there's some people that would just get that, okay, it's the drumstick. I'm cool with that. Then there's some of you else who are like, I want to know that the rectus femoris is the one that goes on the outside. The vastus lateralis is that thing right there. And I'm fine with either one. There's always that spectrum of understanding in the EMS classroom of, you know, the ones that go here and the ones that go here. And if you got questions specifically, we can go there, but we're going to keep it at the EMTB level for this right here. Paramedic, when I teach those kind of classes, we don't hold back. We try and throw as much on you as possible. All right, lower extremity still. The flexion of the hip occurs when the iliopsoas muscle contracts. The gluteal, or the booty meat, muscles and the tensor fasciae extend and they rotate the hip. So back there we got the gluteus maximus, the similis, the semitendinosus. See there, I can't even pronounce these words. That's another thing, is if you can't pronounce a word and you're trying to sound smart to a doctor, you're gonna sound silly like I just sounded. The biceps femoris, so it'll be that back hamstring area right there, right? Those muscles back there. So this can get very complicated. So keep it simple. His buttocks, back of his thigh. All right, make sure we can identify at least that much of it, okay? So anterior means what? Front. Anterior means front. Also ventral means front. Posterior and dorsal mean back. So when we're talking about the anterior portion of the ankle and foot, this includes the muscles that extend the ankle and the toes, right? So we got the soleus, right? We got the tibialis anterior. We got extensor muscles and tendons there. So let me go ahead and give you a brief knowledge of that. Tendons connect muscle to bone. Tendons connect muscle to bone. Ligaments connect bone to bone. Bone to bone. All right. So superficial posterior, we got the gastrocnemius, plantaris, and the soleus. All right, that's pretty much the lower muscles of your ankle and foot. Again, keep it simple. He's got a slice on his thigh or his calf or, you know, whatever. We don't want to create more chaos. When we get to paramedic level stuff, we can get really detailed if you want. But again, even a paramedic does not need to stir up more confusion on scene. We want to keep it very simple, you know, because in EMS, you know, we learn a lot about the patho of certain disease processes, and that's important too. But, you know, what kind of injury could you have to the calf muscle? Most likely it's going to be a trauma or possibly a septic patient or something like that. Your idea, your goal is to what? Identify the problem, mitigate it, and make it better, then take it to the hospital so they can actually receive, you know, long-term tertiary care. You know, I heard Kelly Grayson say this at God, it was an EMS conference a few years ago, and I kept it, and I'm gonna give him credit for it. But EMS is the special teams of the pre-hospital world, of the medical world. What does that mean? Well, it means that, you know, the offense is, of course, the ER. And special teams' job, yeah, they throw a touchdown every now and then, they kick a field goal, but hey, their real job is ball placement. If he's got a shattered, you know, or torn up like gastrocnemius or a torn calf muscle from playing football, I ain't got no way to reattach it on the ambulance. I can, of course, give him pain meds. I can prevent secondary injury. If he's got a broke leg, I can splint it. But he really needs an orthopedic surgeon. And I need you guys to buy into that really, really quickly early in your careers, that we do save lives, we do rescue people, but sometimes we got to realize what is. This is a time for me to do ball placement and kick that guy down the field and get him in the best position that he can be to be treated by a specialist. That makes sense to everybody? I hope it does. I hope it does. You know, I tell people, especially when in regards to trauma is a surgical disease. And we'll talk more about this when we hit the trauma block, but trauma is a surgical disease. At Grady, we had a 10-minute or less on scene time, if possible, for any kind of trauma. Why? They don't need you being Rescue Randy on scene, John. They need a surgeon. Bleeding to death. What can you do for that? Faith, hope, and love. Okay. Don't quit. Stop. Come out. Stop coming out, blood. No. I mean, there are things you can do, but he needs a surgeon more than anything. So if at all possible, you go ahead and get it in your mind for traumas, 10 minutes or less, unless you got extrication or something crazy going on scene. So deep posterior muscles, we're talking about what, who, and where, and why. So this includes muscles that flex the toes and invert the foot. There's a lateral compartment, includes muscles that primarily invert the foot, the Achilles tendon. All right, that's that big white one right here. That's the Achilles tendon. All right, you have a homework assignment. You must do one of the following. Master Kung Fu. It's up to you. You pick one. In world hunger. You must find your nemesis, earn their trust, vanquish them, preferably with an armbar technique, until they tap. Or you must label the muscular anatomy sheet and submit it for a homework grade. Observe how the body works. I'm going to be very, very merciful to you and tell you I have already put this as one of your test questions for this week's quiz. I'm going to sit here and do this with you, okay? That way there's no confusion. All right, so you just got to remember it later and do it on your own. And then I'm telling you right now, it is a test question that is worth 10 points. How many is there, John? There's 10 of them, right? Okay. All right, I got a chat box. What you got? What you got? All right, damn it. Alex is going with Kung Fu. All right, so that's fine. I was hoping somebody would do Kung Fu, and that is him. We're doing Kung Fu. I like it. So, John, let's do this together, and everybody else that can hear or wants to be involved. So, number one. Well, that's not a bad guess. So, are you 100% sure? So, what would be a good testing strategy for this? Do the ones you know immediately and come back, and maybe the process of elimination could actually help you a little bit too, right? All right, so biceps would be where? All right, let's see if I can draw it. God, that's bad. Woo, look at me. No judgment. I don't like ugly. Go to hell for judging me. Look there. All right, so let's see. I got number 2 here pointing towards these 6 things right here. What are these 6 things called? These things I got on my stomach. The 6-pack. Oh, the rectus abdominis. All right, so rec. I'm just gonna put rec abdominis. Oh, you know what I'm talking about. Abs. All right, so let's scratch these bad boys off. Bang. We done put biceps. Ooh. So what do you think? Where do you think the obliques are? Number 9 is the obliques, this area right here. So we'll just put a big O, B, L. That's your external obliques. It's on the outside and it's the oblique part of the abs. There we go. All right. Gastrocnemius. That's that calf muscle, baby. Oh, yeah. So put gastropub or whatever it was again. I am too nice to y'all. I should make y'all figure this crap out for your test. I think I'll do that the longer we can start doing this. All right. What's this one right here, John? This is the one I specifically told you. Sartorius, the Roman gladiator. The one right there by the, yeah, that area. Yeah, the quad. That's what I was talking about. All right. Deltoids, where they at though? All right. Delt.
Brother Devin.
Huh?
Brother Devin, he's got all.
Is somebody commenting?
Yeah.
Oh, I can't see. Oh, excuse me. My little thing was in the way. Let's see. Brother Devin. Oh yeah, I like it. Call me Brother Josh. Amen. All right. Smarty pantses. We're almost there. All right, so where are we at? Here we go. Number 10, we're looking at who? That'd be a quadriceps. Remember, keep it simple. They say something.
Yeah, he said that's his church name.
You know, before I moved to Atlanta, I was a worship pastor. Huh? Is it shocking? All right. Quads is out. Gastronematus is out. So we got 3 left. So by the process of elimination, we know number 5 is who? The pecs. Remember my pec dance I did earlier? Or whatever that was? Pecs. He's out of there. So now by the process of elimination, I think you might have been right. This might be the brachioradialis. What gave it away? Well, the radial bone and the radial pulse is up in this area too. So they're all named for what? Location, origin, size, number of heads. So that one's named why? Well, that too. I draw badly. I write worse. And so this last one will be the tricep. I am so sorry. I ain't sorry. I don't care. I told you I couldn't draw when we started. But we've gone over these and now you know. This is worth 10 points on your next quiz. So got to get after it. All right. So there it is, guys. Clear them all. I guess I'm not. So anybody got any questions while I got you here before I take a commercial break? We're finishing up the muscular system. We're going to do the endocrine system next. And then we're going to call it a night, guys. Anybody got any questions, comments, concerns? I'm on a call, so I have to run for now. Okay. Later, Alex. That's his church name, presume. I like it. All right, so if we got no questions, that's going to do it for our musculoskeletal anatomy. We're going to take a quick break. I'm going to order some dinner because I haven't eaten since lunch. We're going to reconvene here at, let's say, 6:45. We're going to reconvene at 6:45, and we'll start then the endocrine lecture. It's a very short lecture. I mainly just need you to know kind of the ideas behind what the major processes of these things are, the endocrine system and the hormones therein, and how we can affect them in EMS. And then we'll call it a night, guys. Any questions, comments, concerns? All right, we're going to stop sharing. We're going to